Hello friends, today we will see fall prevention and management. Definition: a fall is defined as a sudden, uncontrolled, unintentional downward displacement of the body to the ground or other object, excluding falls resulting from violent blows or other purposeful actions. How to create a safe patient room environment: placing the call bell within the reach of the patient, clearing any clutter from tables, chairs, and floors, positioning furniture, equipment, and assistive devices so they are accessible on the patient's dominant side, placing telephone cords, electrical cords, excessive furnitures, and unnecessary equipment out of the way, lock movable equipment like bed wheels and wheelchair, etc. Shall participate patient and family in fall prevention education and make sure to get acknowledgement signature. Adequate lighting in the room and around the hospital. Check bathroom for water logging and check for slippery floors. Other measures: educate the patients to get out of bed on the dominant non-operated side and with assistance. Frequent observations and assist for toilet need as required. Ensure all movable equipments are locked before transferring the patient. Ensure that the footstool is in place near to the examination table, especially in outpatient department. Ensure patient is secured with safety belt. Instruct the patient attendant to call for help before getting out of wheelchair. Teach patient to use grab bars in toilet. Instruct the patient family members to be with the patient always. Provide side rails. And if high risk, do not place patient on examination table without 1:1 caretaker. In case of the patient who come in their own cars and have physical disability, they shall be assisted by the security or reception staffs at the entry. Special precautions for vulnerable patients. Who is considered as vulnerable patients? Age below 12 and above 60 years. Patients with a gait or balance disturbances, history of fall in the last 6 months, visual impairments. In case of altered mental status patients, instruct the attendant to be with the patient at all times and allocate bed close to the nursing station. Patients on medications such as sedatives, diuretics, anticonvulsants, and antihypertensives. Patients who are not able to perform the activities of daily living that may be at high risk for falls. Patient with crutches or walking sticks, etc. Patient in restraint and pregnant patient. These are all the patients who is vulnerable for fall. Recommendations for pediatrics: never leave a child unattended. Staff will provide the parent with clear instructions on securing their child. For example, if hospital staff leaves a child under the supervision of parents, instruct the parent or caretaker to remain with the child. When appropriate, have parents hold their child rather than leaving the child unsecured. Use cribs with the raised side extensions to prevent active children from climbing out. How to keep a baby safe from falling. Inform the mother to not to fall asleep while holding their baby, as they can fall from their hold. Never leave the baby unattended on an adult bed or other surface from which they may fall. Inform the mother to ask for assistance when moving the baby from their own cot if they feel at risk of falling. When transporting the baby around the unit, always place the baby in their own cot. Walking with the baby in the parents' or staff's arms is not encouraged. Take extra care when changing nappies and bathing the baby. These are situations where the baby may fall. Assessment: all adult and pediatric IPOP-ER patients will be assessed for risk falling by a registered nurse using the standard fall risk assessment tool, and interventions will be implemented at the time of identified the patient as high risk category. And reassessment: patient shall be reassessed for risk of fall if and when treatment changes. if and when condition changes and postoperative cases and post-fall. Reassessment is mandatory in following situation: after any surgery or procedure, after restraint application or removal, if disoriented, if started using an assisted device during hospital stay, after a fall, every day or more if clinically required, every shift if the patient is on medication that causes high risk for fall. Example, patients on anesthetics, anti-seizures and antihistamines. Cardiovascular agents, cathartics, diuretics, sedatives, psychotropics and benzodiazepines. When patient returns from major surgery and after sudden change in patient's condition with short-term altered or decreased level of orientation as a result of anesthesia or narcotics. If in case of post-fall, the management is here. Registered nurse will complete patient assessment and notify the physician. Do not transfer patient for any procedure or surgery without confirmation from the consultant. Determine vital signs to include sitting or standing blood pressure and pulse. If diabetic, check the blood sugar of the patient. And if patient is on anticoagulant drug, withhold drug after confirming with primary consultant. Determine circumstances leading to the fall and complete the fall incident report. Review fall prevention interventions and modify plan of care as indicated. Thank you.